Hi friends, today we are going to talk about endometriosis. Myself, Dr. Narendra Gupta, Senior Consultant and IVF Expert at Vivekanand Hospital and Fertility Center, Jaipur, India. The question comes in our mind, what is endometriosis? Endometriosis is presence of endometrial tissue. You all know there is a uterus and every uterus contains the inner lining which is known as the endometrium. So if this endometrium lining, which sheds every time a woman menstruates outside the body, if it goes in the abdominal cavity and if it proliferates, then it is called as the endometriosis. So presence of endometrial lining outside the uterine cavity and proliferation of this endometrium in any site other than uterine mucosa is known as endometriosis. Endometriosis is a common problem of women during their reproductive period. True incidence of the endometriosis is not known, however it affects 1 to 5% women in fertile population, and in infertility it is seen that it affects 20 to 30% of the women. Endometriosis can be pelvic, that is, it can present in the abdominal cavity around the uterus, or it can be extrapelvic, that is, endometriosis can affect umbilicus, it can affect different scars, scar of the laparoscopy or scar of the cesarean section. The endometrial tissue can also reach up to the lungs and pleura, and other distant sites have also been seen to affect because of endometriosis. When we talk about pelvic endometriosis, then it can be uterine. Uterine means when the endometrium is present in the myometrium and it is there in the uterus itself, then it is uterine. However, extrauterine endometriosis is also quite common. It affects the ovary in 30% of the patients and pelvic endometrium in another 10 to 20% of the patients. It can affect fallopian tube, vagina, bladder, rectum, pelvic colon. Actually, it can affect every part of the pelvis. So it is how the endometriosis is seen. These red spots are seen on the pelvic peritoneum. It is responsible for 70% of the cases of the chronic pelvic pain. As an infertility expert, we get patients from different walks of the life who comes to us with severe pelvic pain, that is pain abdomen or infertility. And when we examine these patients and when we investigate, we find that endometriosis is responsible for 20 to 30% of the patients for infertility. Similarly, patients who are suffering from dysmenorrhea, that is painful menstruation, this problem is very common among the adolescent girls and among the women who are married and suffering from painful menses. Thus, we see that endometriosis is a common cause of morbidity in women affecting their life. Endometriosis is a common cause of infertility and it can be because of formation of the tubo-ovarian masses, it can be because of deep dyspareunia, can be because of impairment of the febrile mobility, and in some cases there can be ovulatory problems as well. Patient of the endometriosis can be asymptomatic, that is, they may not show any symptom. However, many of these patients, they show dysmenorrhea, that is painful menstruation, and you see many women who suffer from painful menstruation, they have endometriosis. Similarly, dyspareunia. Dyspareunia means painful intercourse. Dysgeusia, that is, when they defecate, there is pain. Similarly, many of these women, they suffer from backache, acute abdomen or premenstrual tension syndrome. Menorrhagia, cyclic hematuria, cyclic bleeding is also seen in some of these women. Of course, we have already discussed infertility. There can be a mass in the pelvis, that is a tumor in the pelvis. So they can present in any of these forms. Endometriosis can present in any of these forms. When we suspect that a woman is suffering from endometriosis, then we advise some investigations, and these investigations are ultrasonography, laparoscopy, cystoscopy, MRI if the diagnosis is not certain. Sonography, especially transvaginal sonography, is helpful in the diagnosis of endometriomas and bigger lesions of the endometriosis. This is an ultrasonographic picture of an endometrioma. Endometrioma means ovarian endometriosis. So in ovarian endometriosis, the ovaries are oval or round. These cysts are capsulated. There is fine homogeneous uniform granularity seen in the ovarian cyst, and this can be unilateral or bilateral, that is, it can present on one side or both the sides. MRI is very accurate in diagnosing ovarian endometrioma, however, it's less specific in diagnosing
Hi,
isolated
my name is
endometriotic
Narendra
foci.
Gupta, and
Laparoscopy is
I'm
the
going to
gold
talk
standard.
about
Endoscopy, that is we call
endometriosis today.
endoscopy. It
So,
permits a
I
see and
have
treat
Dr.
approach.
Narendra Gupta with
So,
me, who
whenever
is
the diagnosis is
infertility and
certain that
IVF
the patient is
specialist
suffering
at
from
Vivekanand Hospital
endometriosis or
and Fertility
endometrioma,
Center.
we do laparoscopy, and during
So,
laparoscopy, we not
इस
only
तरीके से जब
diagnose the
यहाँ पे मेरा ऑडियो
endometriotic
खत्म
lesions,
होगा
we can
तो मैं यहाँ पे
simultaneously
इसको
treat the endometriosis. So, the treatment depends on according to the age of the patient, the presenting symptom, their severity, and desire for fertility, that is, if the patient want to preserve the fertility. Two of the most important considerations in treatment are infertility and chronic pelvic pain. Of course, the medical treatment is tried first, that is, pain relieving medicines are given, combined oral contraceptive pills, GnRH analog injections, or progestogens are given to these patients to alleviate their suffering. Surgical treatment can also be contemplated in some of these patients, like endometrioma excision or ablation of the endometriotic lesions. Combined treatment is also advised in some of these patients. Of course, those patients who are suffering from infertility, IVF, and other assisted reproductive techniques can be carried out to give them the child. To conclude, I would say endometriosis is a common problem in women of childbearing age. Ultrasonography and laparoscopy are effective diagnostic tools. Timely diagnosis and treatment can prevent long-term complications of the endometriosis. That's all about endometriosis. If you have further queries, you can contact me on my email address drnarendra12@gmail.com. If you like my presentations, kindly press the like, or if you want to leave any comment, kindly leave comment in the comment section. Thank you very much.